Response to the COVID-19 crisis. All weekend, I know state officials and local officials were working hard, not just managing through the different aspects of what we've put into place over the past couple of weeks, but also looking at innovative ideas and bringing some solutions to the real front of the table for us. So again, as we're making these decisions, as we're moving forward, we're being responsive to what those individual needs are, really at the grassroots level. We want to thank them. I was on a phone call this morning with all the different mayors. I was on a call this morning with a lot of different House members, all just giving feedback over the past few days in terms of what they're seeing on the ground, maybe some of the issues that we have to still address. These are unprecedented and times that we're going through, and again, we just want to make sure we're being responsive to those individuals. But today's, we want to announce three pretty significant efforts on a variety of different areas. The first being, I want folks to know that today I'll be informing the federal government and the Department of Education specifically that standardized tests will not take place in New Hampshire this semester. And while remote learning has gotten off to an incredible start, we have to continue to have flexibility in our approach to education. And onerous standardized tests from Washington, I think, definitely send the wrong message to New Hampshire families who are already working incredibly hard to adapt to this new learning environment. The New Hampshire Department of Education will continue to work with the College Board to create access for students wanting to take the SATs this summer or in the early fall. And New Hampshire Department of Education will also work with all New Hampshire schools to develop options to help gauge student performance, and will continue to work with teachers, schools, and families to have access to the assessment materials for remote instruction for all of our students. Secondly, in conjunction with the Federal CARES Act, that was recently passed, we are increasing benefits for those on unemployment. Granite staters currently drawing from the state's unemployment insurance program will, in most instances, be shifted to the federally funded Pandemic Unemployment Assistance Program. And for those on the Pandemic Unemployment Assistance, we're increasing the weekly minimum benefit from $32 a week to $168 a week. And then starting next week, we're adding an additional $600 per week per individual to their weekly benefits, all 100% federally funded. We're extending the length of the time a person can receive benefits by 13 weeks for up to 39 weeks, which again will be federally funded here in New Hampshire. It's important to note that those who are already drawing from unemployment insurance will not need to take any new or additional steps. You should just continue to file as you have been through the state channels. This opportunity is really building on the fact that New Hampshire was able to be one of the first states in the country to offer the expanded unemployment insurance benefits, and the fact that the federal government has come in behind us, enhancing those benefits as well, will create an incredible opportunity for those individuals and families around the state. On those same notes, I just want to always extend a big thanks to Employment Security Commissioner George Kapatis, Assistant Commissioner Richard Lavers. They have really been working around the clock. The fact that the federal bill just passed a few days ago in the CARES Act, and that they've been working to help ensure that these benefits can be accessed immediately, as early as today, and just a real testament to them and their team working with the U.S. Department of Labor and all the folks on the ground here in New Hampshire. I also want to address one final point that also kind of goes to the fact that we started this program so early. New Hampshire had the highest increase in unemployment benefits between the time of March 14th to March 21st, anywhere in the country. But again, it was really because we had opened up our unemployment benefits more aggressively than anywhere else in the country, and the fact that the federal government here has come in to not just support but enhance those benefits will provide a lot of opportunity for individuals across New Hampshire. Third, we will be announcing later today that the state will be extending the business tax payment deadline to June 15th for approximately 98% of New Hampshire small businesses, as many continue to adapt to these unfortunate new realities of the COVID-19 crisis. The state will also be extending interest and dividends tax payment deadlines to June 15th for, again, approximately 98% of the interest and dividends taxpayers. As was discussed last week, Congress, as we know, passed and the President signed the CARES Act. But as a result of this bipartisan legislation, we have gone through the bill and we have confirmed New Hampshire will be receiving at least $1.25 billion in COVID-19 relief. It's an unprecedented amount of relief for the state of New Hampshire, but given the unprecedented times and the severe needs from families, education, businesses, individuals, there is going to be a need all the way around. So while this is a large amount of money, it is being allocated and dedicated to a variety of different programs throughout the state. Among the highlights, the federal legislation creates the Paycheck Protection Program, where small businesses can get 100% forgivable loans to cover the salaries and benefits of their employees, mortgage interest, rent, and utilities for up to 8 weeks. Again, a real incredible opportunity for a lot of the small businesses out there. There's also support for the Child Care and Development Block Grant, financial support where funds can go towards our daycare initiative that we announced just last week. So a lot of the subsidies and supplements that we provided in our child care and daycare initiatives, again, are going to now be backed by the federal government, which is very exciting. There'll be additional support to the Substance Abuse and Mental Health Services Administration for mental health and substance use disorders through certified community behavioral clinics. In addition to the $50 million healthcare relief fund that we set up very early on in this process, the federal legislation will provide additional grants to hospitals and nonprofits and other institutional providers to help cover the unreimbursed healthcare costs of this COVID-19 crisis. We've started a plan on how to best operationalize all of these different opportunities, and we'll continue to dig into the details so that we truly can better understand what the state allocation will be, what restrictions the federal government may have placed on them, and again, just how best to use these funds for the citizens of New Hampshire. We will, as always, continue to update the public as we explore more opportunities, and knowing that in working with our congressional delegation, this is the third supplemental enhancement dealing with the COVID-19 crisis. There will likely be a fourth, probably in a month or so is what the hope is. And so any of the holes or the gaps in the system that aren't being covered by the current funds, we always will have another shot to go back and work with our partners in a bipartisan way within the federal government to help, again, provide some of these federal funding opportunities to fill those gaps and respond to the citizens of New Hampshire. And lastly today, we want folks to know that we are requesting today our major disaster declaration for New Hampshire from the federal government, and in doing so, it will allow a variety of opportunities, but one in particular, our National Guard to be fully reimbursed by the federal government should we enact Title 32 status to mobilize our state National Guardsmen and women to help respond to the COVID-19 crisis in a lot of the different staffing realms that they potentially could be called up for. I'm now going to turn it over to Dr. Benjamin Chan, who will come up and give us an update from the Department of Public Health. Dr. Chan.
Great. Thank you very much, Governor, and good afternoon. Let me first start by providing some updates on the numbers in terms of what we're seeing in New Hampshire for testing and diagnoses of COVID-19. So to date, over the last several weeks, there have been more than 5,700 people in New Hampshire tested for COVID-19, and currently we have 314 people who have been diagnosed, confirmed with COVID-19. That's an increase of about 56 individuals from yesterday. So over the weekend, Saturday and Sunday combined, we have had about 100 individuals diagnosed with COVID-19. The majority of these individuals are people with more mild infection who are at home and self-isolating at home. About 45 of these individuals, were about close to 15%, have required some hospitalization during the course of their illness, and unfortunately 3 individuals have passed away as a result, either directly or indirectly as a result of their infection. All 3 of these individuals were people that were older than 60 years of age and had multiple underlying chronic medical conditions, which is exactly the age group that is most at risk for severe complications from COVID-19. And so our sympathy and our thoughts are with the families that have been dealing with this situation in these difficult times. And I want to also remind everybody that this is exactly the population of residents in our state who we want to protect, especially from COVID-19. And so I think we all have a role in playing to do that. As COVID-19 spreads, both globally as well as within the United States, we can expect to see an increasing number of cases in New Hampshire. You may have heard it said, and I will repeat here, that the United States is in the acceleration phase of the pandemic of COVID-19. And so we are going to hear about increasing numbers of cases in the United States as a whole over the coming several weeks. We will continue to see increasing numbers of cases within New Hampshire. And this is something that we're obviously actively monitoring, but we're not just sitting back and watching the numbers. We're actively out investigating people diagnosed with COVID-19 to identify potential susceptible contacts who we reach out to and recommend either go on quarantine if they are without symptoms, meaning stay at home, even with a lack of symptoms, or if they are symptomatic, have recommendations for staying at home, potentially testing for those that are at higher risk of potentially transmitting COVID-19 within our communities. We've gotten a lot of questions over the last several weeks about where this virus is it spreading in their individual communities. We're seeing an increasing number of people being diagnosed that have no specific risk factors identified, meaning they may not be identified contacts of other people with COVID-19, may not have traveled, and so we believe there are increasing numbers of people with community-based transmission of COVID-19. And so I think one of the key messages now is that this virus is out in our communities, it is circulating, and so everybody needs to take steps and precautions against not only getting infected themselves, but also spreading infection to other people within our community, certainly those who are most vulnerable. I want to make quick mention that there is, as I've mentioned before, there's increasing evidence that people can spread this virus before they may have symptoms, what we call pre-symptomatic transmission. There have been a couple of studies that have come out in the last couple of weeks looking at different populations like the Diamond Princess cruise ship and certain long-term care facility populations, for example, in Washington State. And what some of these newer studies have shown us is that of the people that have tested positive in these organizations, a large percentage of people, potentially up to half or more, have potentially shown tested positive for this virus in the days before they showed symptoms. And I say this to highlight a point that it's not just people that are symptomatic in our communities that need to take steps to stay home to prevent transmission within our communities. This is the reason for the recommendations around social distancing in general. And so everybody in our communities need to take steps to prevent exposing and passing on this virus to other people within our communities. So if people don't need to go out urgently, please stay at home. If people are out, for example, at a grocery store or needing to go into the hospital, for example, social distancing recommends maintaining at least 6 feet of distance between oneself and another person. So we ask that everybody in our communities, whether they're even if they're not having any symptoms and otherwise feeling well, to please abide by these recommendations for staying home if going out is not necessary, and for maintaining at least 6 feet of distance between people when out in the community, for example, at a grocery store. That includes waiting in lines, or other, even walking outside. Please try and maintain social distance between other people. I want to also particularly mention that those who are 60 years of age and older, or people with chronic medical conditions, as I've already mentioned, are at increased risk for complications of COVID-19 and potentially requiring hospitalization, potentially even dying from this infection. And so those individuals especially, we recommend try and more strictly stay at home. Those individuals need to have a 30-day supply of needed medications at their homes, maintain a supply of food and groceries, and I think all of us in our communities need to try and protect those more vulnerable groups by, unfortunately, avoiding close contact with people that may be more susceptible to serious infection that could cause a loved one to end up in the hospital. So we are continuing to monitor and track the situation. There have been requests for more information, potentially at the community level. We are going to be releasing more information on our website in the next day or so, including maps looking at the number of cases at the town level. We have heard the request and the need for more information, not only from the public, but from local healthcare and public health partners. So we will be releasing more information on this in the next day or so. But I want to stress again that even if you live in a town where a map may not show that COVID-19 has been found to be circulating, that we would encourage people to operate under the assumption that COVID-19 is circulating in your communities, even if there has not been somebody officially diagnosed, and to take the appropriate precautions to maintain social distancing, to stay at home if it's not necessary to go out, in order to not only protect your own family and friends, but people that may be more vulnerable in your communities, including older parents, grandparents, neighbors that may be of an older age, or certainly people living in long-term care or assisted living facilities. So thank you very much.
Well, thank you, Dr. Chan. With that, I guess we can open it right up for questions if folks like.
Do you think the Granite State needs to do better at staying at home?
Do I think the Granite State needs to do better at Look, no, look, we can always do better, right? But I got to say, I think the Granite State has done a very, very good job. So I guess that's my preeminent statement. We saw a lot of folks out and about this weekend. They were out exercising. They were out getting their groceries. They were doing things that they need to do or that are allowed to do under the stay-at-home order. And then they were headed home. We saw a lot of folks in the parking lots at Mount Major and others where they were hiking. But at the same time, if you looked at that crowd control that was really happening on the while people were hiking or at the top of the mountain, we had staff up there looking, and in very few instances were people really not managing the social distancing. I think people are taking this incredibly seriously. I've been at the supermarket myself, and people will literally walk on one side of the aisle and the other side of the aisle. They're trying to keep as much space between themselves. And they're realizing they can do that without really hindering their ability to go grocery shopping or actually do things that they need to in their everyday life or at work, of course. So no, I think the Granite Staters have done a great job, but we're in this for the long haul. We need stamina, we need discipline. We need to do this not this week, but next week and next month and probably the month after that. And so building these practices now and seeing how they work out in the real world, so to say, has given us a lot of useful information. I think individuals a lot of better information. And how we see each other act, right, also I think helps us say, well, boy, they're doing it, I got to do it too. There's almost like a social rising, if you will, of this idea of not just social distancing. I think we're kind of evolving that term to more physical distancing, right? We want people to socialize using technology. We want people to socialize with an elderly parent or relative that might be in a nursing home that right now can't have visitors. We want that community connection and use technology to do that while maintaining those physical distances. So I guess that's a very long way of saying I think we're doing a great job, but we need the discipline and the stamina. We can always probably find individual moments where we can do better. I found myself in the office today. I rarely come closer than 6 feet with almost anybody nowadays. I'm incredibly careful myself. And I found my staff, even making sure the limited staff we have at the State House, everyone's kind of staying in their area, waiting to folks to use. Only one person goes through a doorway at once. Only one person might use an elevator at once. They're taking it very seriously, so they need to be commended for that.
What about out-of-staters? Someone has asked people visiting New Hampshire for long-term visits, self-quarantine.
Yes.
What was your thinking there, and are there particular concerns with communities that you've heard? People with second homes, people coming out of cities to be up in the woods.
Well, sure. So the question really revolves around the thinking behind the social distancing request and, more importantly, the quarantine request of out-of-staters. The thinking is just, frankly, common sense. The fact is that most states have a much higher prevalence of COVID than we do right now. A lot of folks are coming specifically out of Massachusetts or maybe even the New York region where the prevalence is incredibly high. If you're coming here for an extended stay, you need to really be self-quarantining for 14 days and practicing those same social responsibilities that you had in your states. Here, we take those very seriously. Just because we're in New Hampshire, we don't have as high of a rate now. That surge is coming. As Dr. Chan pointed out, we are in an accelerated phase. Our numbers are going to continue to accelerate. Everyone has that responsibility of taking it very seriously. And if you're coming from out of state, we're asking you need to self-quarantine.
Well, we were on the call you referred to earlier. Is this a concern of local officials?
Yeah, well, sure. Yeah, we've heard the concern all up and down the state, to be sure. I think the concern is a couple-fold. The concern is, well, we've been very, very aggressive and successful in our state building our surge centers, right, in terms of the excess bed capacity. I think there's a concern that if other states around us don't have that same capacity, if their surge comes faster and harder than ours here, you could potentially have folks from Massachusetts coming over to use our healthcare facilities, right? And so, again, we want to make sure that regionally, all of our state partners are also in that same boat, building that surge capacity, so one state isn't over handling the potential healthcare surge of another. There's folks up in the North Country that, again, that's where a lot of these secondary homes for folks out of Massachusetts might be, and so there's just a natural concern there from local officials. I said it last week, we're not shutting the borders down. I don't have the power to do that. I know Governor has the power to do that, but we just have to maintain a vigilance and a good, strong community message that if you are from out of state, you do need to self-quarantine for 2 weeks.
As far as the major disaster declaration, do you
Yes.
plan on bringing in the National Guard down the road for?
Well, we want to be able to react at a moment's notice and know that we can do so with the federal funding behind us. So at some point, will we get there at some point? It could. For example, Massachusetts called up some of their National Guard for the primary purpose of filling in the gaps with first responders, firemen, firefighters, those that might be quarantined because they may have come in contact with somebody. We're finding a lot of folks on the front lines are being quarantined, and then those frontline staffs are getting depleted. So that was one reason that he did it. Our states, I talked to governors all over the country. They're doing it for a variety of different reasons. So we don't know exactly why we may need to do it. My sense is at some point we will. We just want to have the readiness and know that the federal government's going to be behind us when we do.
As far as the 314 cases go, I don't know if this is for you or Dr. Chen, how many of those people have recovered already? Do you have that?
Sure.
Thank you. Yeah, that's a great question. Let me pull up my notes here to make sure that I have accurate numbers here. So, correct, 314 people diagnosed in New Hampshire with COVID-19, and as of today, we're aware of at least 46 of those that have who have been diagnosed and recovered. Again, the majority of these individuals that have been diagnosed with COVID-19 have not required hospitalization, and so we're communicating with individuals about how long they need to stay home for, and it's going to be at least 7 days from when they develop symptoms, possibly longer, depending on how the symptom progression continues. But the majority of these individuals will be coming off. Additional people will be coming off home isolation in the coming days, so we can expect more people to have recovered.
And just about Coos County, right now there are no cases reported. Is that because there are no cases, or is testing slower up there?
Yeah, it's always hard to know the reason for there not being diagnosed cases in a particular area. And as I mentioned earlier, I think we all need to operate under the assumption that COVID-19 is potentially circulating in our communities. That includes towns in the southern part of the state that might not have had anybody diagnosed with COVID-19. It also includes the northern part of our state in Coos County. Some of the reason for there not being diagnoses could be, more mild illness that's not being tested and clinically and laboratory diagnosed, but I think that given the way we've seen this virus spread and how easily it spreads between people, that the assumption here is that it's circulating in most of our communities around the state.
Dr. Chen, could I ask Dr. Chen with regard to incidents? I'm sure the governor's heard this as well. Rockingham County, at least until the numbers were released today, have had 3 times the number of cases of any county in the entire state. If it's just proximity to Massachusetts, you would think Hillsborough County's results would be similar, but they're not. Is there any idea why?
Well, I think partly what you're seeing in terms of the numbers, again, the majority of cases that have been diagnosed are in Rockingham, followed by Hillsborough County, and those are the areas of the state that have the higher population density centers. Obviously, as you mentioned, those areas of the state are closer to throughways for people potentially traveling up from Massachusetts. But there's also, I know, probably a large percentage of the population that live in New Hampshire that might travel down to Massachusetts to work. So we've certainly seen instances of, cross-border transmission where people are coming up from another state, but also people, that live in New Hampshire that go down to work or interact with family in different areas. And so that's certainly a risk factor, and I think it likely reflects the numbers that you're talking about, where the greater number of cases are in Rockingham and Hillsborough counties.
From the epidemiologist perspective, do any alarm bells go off when we hear about
4th of July levels of traffic up in Mount Washington Valley, even if those people, even if, 90% of them stay in their cars, some are not. So is that a problem?
So I guess I want to stress that this is a virus that we know is circulating in our communities. So it's spreading between people in New Hampshire. Travel continues to be a risk, and as I'm sure many are aware, over the weekend, the Centers for Disease Control and Prevention released some travel advisory guidance around people from certain states avoiding non-essential travel because of the risk for carrying it from one part of the United States, from one state to another state. And so that's certainly a risk factor, but I want to stress again that anybody who may be coming into our state from these higher areas of incidence need to self-quarantine for 14 days. That is advice consistent with what the governor mentioned, but also advice put out by the Centers for Disease Control and Prevention. And as a general rule, people need to, even if they're outside hiking on a trail, need to maintain a distance of at least 6 feet between people to try and limit transmission of this virus, given how easily it can spread person to person.
Governor,
Yes.
any reports of non-essential businesses defying the order remaining open?
No, not so much of folks defying the order. I think we've had a lot of non-essential businesses use our website to request some sort of exemption. We heard a lot of people that want to golf. And we can appreciate that, and I guess that's something that we can look at down the road. One of the benefits of something of an organization like that is it's still April. We're still in the shoulder season for a lot of businesses that weren't expecting a whole lot of business anyways. I think the fear is that where are we going to be in May or come Memorial Day in June and July, and obviously we're not quite sure. I think we all know that the surge is still coming. Is it 2 weeks away, 3 weeks away, 4 weeks away? Not sure, but again, our job is just to be as prepared as we can. You then mix in not just on the business side, but we talk about testing and the fact that when we were first started this 3 or 4 weeks ago, we were doing 100 or 150, maybe even 200 tests a day. Now we're ramping up to close to 400 or 500 tests a day, and hopefully, as some of the other additional labs and other testing capabilities come online for other hospitals and facilities in New Hampshire, that'll keep ramping up and escalating as well. And all those are good tools and data that we can use to help again suppress that viral spread. That's what this is all about. So we didn't hear so much of folks defying the order, but one thing I can tell you is we had a lot of businesses call and say, well, can retailers do curbside pickup, right? If they're not interacting with customers, if we're just doing curbside pickup, no cash transactions, no transactions at the window, you call ahead or you go online and buy the product and you show up. And yes, I want to encourage that, and we are providing those exemptions, if you will, because we want to incentivize people to challenge themselves to change their model, right, to meet the needs of public safety and meet the needs of the physical distancing. So if anything, we've heard good stories, I think, of people trying to change their model, understanding their social responsibility in this. But we'll deal with issues on a case-by-case basis.
By what process we judge?
Yeah.
What are the criteria for judging?
So those requests will be made to the Department of Business and Economic Affairs. They have a small group there, and along with myself, that if there are things that rise to the level where instances or business dynamics that we didn't anticipate that might have more flexibility than we thought, that might allow for the physical distancing more than we thought, or just the opposite. Maybe there are essential businesses that we're realizing are still creating a social dynamic that isn't acceptable, a physical proximity that isn't really acceptable in the model. We could go harsher as well. Again, all uncharted territory for a lot of us. We're sharing our ideas and what we're seeing with other states and seeing what they're doing about certain instances. One thing I'll bring up with the beaches or a golf course or something like that, one of the challenging parts of that is if the states around us aren't opening their beaches and their golf course, that means that when we open up, if we were to even find a unique model, all these folks from Massachusetts and Maine and Vermont are going to rush into New Hampshire to use those types of facilities, which again is counterproductive and counteractive to what we're really encouraging people to do, which is stay in your own homes, whether you're in New Hampshire or in Massachusetts, stay in your own homes. We want folks to stay in their state and stay in their homes as much as possible. So we don't want to, even if we have a creative model, we have to be cognizant of what our partners around New England are doing so we don't have a run on the system from outsiders.
So when those decisions are made, I'm assuming that Dr. Chan or public health types are looped in, and it's not simply people at the
Oh, sure. No, no. Look, one thing that everyone in the state should be very proud of is this has been a team effort all along. So I meet with, whether it's Perry Plummer, Lori Shibinette, Dr. Chan, General Conway. We have our senior team that really comes in and provides a lot of the kind of final checkoff on a lot of the decisions that we're making. And also when we get some constituent issues that come up, whether they're from a business or an organization at a larger level, an individual level, those are all flowing through a single chain of command as well. So the communication has been very, very good at the state level. And we'll continue to do that to make sure we're all in the same boat on the picture. We haven't looked at I made a unilateral decision, I shouldn't say unilateral. In talking to them, we just made that decision on Friday, I believe. We made two decisions: one with real estate, the Real Estate Association and brokers, how they can continue to do transactions, and we looked at the language and stipulations that were given in other states to do that and provide them some flexibility. Again, similar to our neighbors. The other one being the curbside. That made perfect sense. I was talking to Senator Susie about that, about some of the businesses in some of her districts that were calling and asking if they could have that flexibility, and knowing that there was going to be the weekend was coming up, we wanted to, again, before they just shuttered and got rid of a lot of their employees, we wanted to provide that flexibility. But going forward, we'll take them on a case-by-case basis. That's one of the benefits we have in New Hampshire, that we can really focus on the individual or the individual businesses and their needs.
Governor, you made some steps today regarding state business taxes. I know you've heard from some mayors, some city managers who would like to see if you could provide some kind of exemption for people paying local property tax.
Right.
Can you do that?
Yeah.
Without legislation?
Right now, we're not in the position to provide that kind of relief. One thing we are looking to say, look, you don't have to pay your property taxes, or we're going to, cut them in half or anything. That's really a local decision. But one thing we can do is possibly create a pathway so folks don't get the interest and the penalties and things of that nature. Again, so we're not penalizing folks that cannot pay early on. We're allowing them to defer maybe a couple of months at the local level. We don't want to create an opposite situation where you take everything away and you're just incentivizing folks just to not pay even though they could. So it's about really striking that right balance with communities so folks are paying when they can, but allowing some flexibility for those who are a bit in some economically challenged times right now.
So does the waiver on the testing, the request for the waiver, is the state envisioning that maybe testing could take place in the fall, or you don't know the future of this?
Right now, no. I'd say that we are waiving standardized testing for this school year. The testing that we referred to that might come back in the summer or the fall would be like the college boards and the SATs. But no, I think we're going to straight waive the testing for this year, because come the fall, kids will be in the next grade and moving on to that academic curriculum for those tests.
This is all kind of
Oh.
unprecedented balancing act for everyone involved. But do you have to worry at all about the mixed message factor? Stay at home, but try to do as much business as you can. Stay at home, but get out there and exercise.
Absolutely. No, look, it's very tough to balance. I mean, the question really about, is there a mixed message there? Well, we don't think there's a mixed message, but there's a balance in the message, right? There's a balance of social responsibility where we say, look, you can go out, if you want the exercise and you need to go get your groceries or whatever it is. But if you don't need to be doing one of those 3 or 4 stipulations that we've outlined, you got to be at home. That's the order. You really do need to be at home. But we want people to, again, not just, be outside frivolously, because that isn't in their best interest of their health. There's just no question about that, and the best interest of the health of the community. So it's not a mixed message as much as it is kind of a balancing act of saying, look, this is where we're coming down in terms of the government. That's a very tough call to make as a government in the live free or die state, as you can imagine, and we don't take any of it lightly at all. But it's also part of the benefit of this is elevating that message. We want folks to understand how serious it is that we are taking this, and that they have to take this in their individual lives, with their workplace, with their communities, and their families. That's really one of the underlying points here. And talking to the hospital system, that was one of the points they made very loud and clear, that we want this message to be elevated. Understand it is unfortunately probably here for the long term being weeks to months. And then we'll see. Someone asked me today, what are the metrics to undoing a lot of this? What are the metrics to providing more flexibility? I wish I had a good answer for that, but we're not there yet, in that we've never seen the models on the back end. We've never seen any community in this country come on the downside of this in terms of how they come out and provide more flexibility. I can tell you this, I think the challenge is going to be greater in providing flexibility than it was in providing the restrictions. Because what you don't want is truly that mixed message where we're saying we can provide more flexibility, but still we want people to take the social and personal responsibilities very seriously as we see numbers go down, as we can provide a little more flexibility. But we don't want to do it so fast that we see another surge on the back end. And that is going to be, I think, one of the more challenging decisions that we're going to have to make. And we're already starting planning for that. Don't know exactly what the metrics will be. We'll have to look at some other communities and see where our data is. But I can tell you that's one of the ones that really weighs on our mind, that that's going to be a bit of a balancing act for all of us, I think. Yes, sir.
Last week, I asked a question about, is there a backlog on processing people who died with symptoms from COVID? And I'm trying to understand what the lag time is. If the normal person is alive and tested in 7 days, if there's somebody that potentially died, what's the backlog? And I'm hearing from at least 4 families that say they can't make arrangements, they can't have the body released until it's processed.
Mhm.
Some of these
From the medical examiner's office, I assume.
family, right.
Right.
So the question is, and the reason why it's
Yeah,
important
sure.
is it speaks to, is 3 really the death number, or is it gonna spike when the test?
Right. Right. So first, I'm going to ask Dr. Chan to come up to talk specifically how we determine the number 3.
Yeah, so maybe if I can ask for a little bit clarification of your question. Are you asking about a backlog of people who died at the medical examiners, or are you talking about at the funeral home? Because not everybody, I mean, people unfortunately are passing away in the state and other states all the time.
Died that had COVID-like symptoms,
Mhm.
and the families are being told the test has to be done before the body can be released.
Yeah, so I'm not aware of a large number of people that have died that are awaiting testing. With that said, we may not be the first people to know if someone has passed away and is being tested for COVID-19. But as I've mentioned before, that we can expect to see an increasing number of cases of COVID-19 in the state in the coming days and weeks. Certainly an increasing number of people who are hospitalized, and that includes, unfortunately, an increasing number of people that also die or have passed away from COVID-19. Sometimes there can be a lag time between when somebody passes away and when a test result can come back. But as testing capacity increases, hopefully that there should be a shorter and shorter lag time between that waiting period. That may not directly answer your question, but I think part of the decision makers on who gets tested in the event of a death are not only the healthcare providers, but also potentially the medical examiners. And so it's hard to give an exact answer, but I'm not aware of a large number of people that have died that are waiting COVID-19 testing.
So a quick follow-up question would be, if somebody has the symptoms, did go to the state medical examiner's office, is the testing the same lag time as it is on a live person, say 48 hours, or somebody to get the results?
Yeah, I think partly that's a question for the medical examiner, but oftentimes testing can be different in someone who has passed away from a disease, especially if it's unknown the reason or the cause from being passed away. But certainly, whether someone's in the hospital or has passed away, the same kinds of samples like nasal swabs, throat swabs can be run. If there is question regarding the cause of the death, there could potentially be more extensive testing that is performed, and some of that testing may need to be done through the medical examiner or potentially even at the Centers for Disease Control and Prevention. So it depends on the situation and the events surrounding a person's death in terms of how much testing gets done. Yeah, thanks.
Give us an update on the testing backlog. And potentially, we got
Yeah.
somebody emailed us saying they're still waiting after 14 days. What is the situation?
Yeah, so our public health laboratories have worked through the majority of our backlog. I think currently pending, there's only about 60 to 70 tests that are pending at our public health laboratory. So that's certainly down from the middle of last week when we had 800 or 900 tests pending. I think we have Dartmouth Hitchcock Medical Centers to thank for that, who took some of our samples and worked through some of the backlog that we had. I think we're hearing these reports as well of people that have waited a week or more for test results to come back. Now that our public health laboratory has worked through the backlog that we had, testing at our public health laboratory should be much less. Within the order of a day or two, we would hope. from the time that we received the sample. But I am aware of other testing centers, commercial labs, for example, that also have backlogs where the turnaround time has greatly lengthened given the demand for testing. And so I think it's important for providers that are waiting on tests to understand where their tests are going. They may not be coming to the public health laboratories. They may be going to a commercial lab out of state. And so we are hearing that there are backlogs, but at least at our public health laboratory in New Hampshire, we've worked through the backlog that we've had and should have a much more reasonable turnaround time now. Thanks.
Dr. Chen, Governor of Vermont announced last week they were expanding their criteria for testing. They were testing people with even more milder symptoms of COVID-19. Is there any consideration of doing that here? Is there a need not necessarily to do that, given the level of the pandemic?
Yeah, that's a great question, and you know, I think in the ideal world we would do as much testing as we're able to. Sorry, providers would do as much testing as they're able to, especially if that's combined with contact investigations to identify potentially exposed, susceptible individuals. And our public health team continues to do those contact investigations on the 314 people. As the number of cases increases, it becomes harder and harder to keep up with those types of investigations, which can be very time-consuming. So as I've mentioned before, you know, it's not test kits themselves that are the limitation with testing here. It's the whole supply chain for the testing process. That includes the personal protective equipment that providers need to wear to do the testing, the swabs for sampling, the transport solutions that are needed to transport a swab from the site of collection into the laboratory. So many of those key pieces of supplies and equipment still remain a limitation. We're actively working to try and increase supplies of personal protective equipment and the swabs and the reagents that are needed for testing. And I think as we have increased capacity to test, we will certainly encourage providers to do testing on patients. But given the reality of the situation in New Hampshire and nationally, understanding that there are limitations, certainly in personal protective equipment and some sampling supplies, we continue to prioritize testing for those who are at highest risk of potentially spreading this in communities. That can include healthcare providers, first responders, people that live or work at long-term care facilities, for example, people that live or work with more vulnerable populations. But I want to also stress that you know, testing and public health investigations are an important tool to try and slow the spread of this virus. But we can't test our way out of this pandemic, right? This virus spreads so easily, and with the potential for people shedding and transmitting virus even before they might have symptoms, really highlights the need that, you know, yes, testing is important, an important tool, but one of the key ways to slow and prevent spread of this virus in our communities really are the social distancing steps that we have and will continue to recommend people take to prevent the close contact that's required for this virus to spread between people. Thank you.
Okay. Well, thank you all very much. Again, we'll just kind of keep bringing updates. Today was, I think, there's a lot of positivity out there, a lot of relief in terms of what the federal government is doing in backing up some of the initial programs that we got started here. It's all about providing that flexibility, but also maintaining that social responsibility and that physical distancing within our home and our workplace and in our private lives, that we are going to have to be in this for quite a while. So we appreciate everybody's patience. We're in this for the long haul. We're in it together, and we will get through it. Thank you, guys.